Don't worry about it. And I think yeah, or maybe I can see there so that I'm not in the way. You want to do please, Shane? I just so that I'm not in the way. Thank you. I'll sit right in my, my chair. My knees up high.
Everyone's trying to sit up straight, right?
Yes, maybe I take her to my office. Thank you. You have it. Here, Esther. Stop it. Put me down. Put me down. All right, she went. Well, it's about, this is everybody. Should I make some introductions? Yes. Yeah. Okay. So just a quick, the concept is brown bag. I don't even know if that's a concept anywhere but the US, so I apologize for my ethnocentrism or whatever, but the idea is that it's just a very brief thing and we eat our lunches. So hopefully everybody figured that one out. Sølve is a pretty cool person. Tina and I met you and you're considered an expert in Denmark about non-binary trans issues. You work with youth, you work with kids on the spectrum. You're one of the first people I've ever heard talk about the intersection between psychology training and economic privilege, which I think is very fascinating. So, we wanted to give everybody some exposure to some trans issues. Also, in a couple of weeks, we'll be talking about race. And so thank you for coming and yeah.
Thank you so much.
Take it away.
So it was a bit of a tall order to talk about everything around gender in this amount of time. So I want to begin by introducing a bit of my work, and then I will go slowly on to what is relevant regarding gender in therapy, but also cisgender people, heterosexual people, and then move on to very low practical advice. And I have some literature recommendations, and I have more at home, so I can just send you stuff, no problem. Cool. So what is important to notice is that I'm not motivated by any specific school of thought. I'm not motivated by any certain ideology in my work, but it is simply because I am a person that is queer. I'm non-binary, and I was also socially troubled myself. So it is kind of a very practical approach to what works, and it is looking a lot out there for what kind of approaches we could use. And there is a lot to work with here in Denmark, and especially not considering doing therapy with minority clients. So I might say some stuff that you don't agree totally with, and that is fine. I very much like Donna Haraway's approach to science, that we all have certain technologies that is available at the time and place for looking at different phenomena. And everything is sort of biased, or we're all inside the monster's belly, and we all have varying views depending on culture and etc. And by making that statement very clear and by self-disclosing, we can move to a higher degree of truth in our work. So that is also the idea why I'm self-disclosing and why you know who is the person speaking about this. So when we talk about at times when therapy does damage, we talk about unhelpful things and maybe a lack of knowledge in a lot of areas, and even some therapists that might not have been totally great at all times. But what I'm meeting a lot in my critical work with the psychology and by my clients is that there's a lot of people who have been damaged by ideas of gender and ideas of sexuality tied to gender. And it is also something that affects even my majority of people a lot. So I work with a narrative approach, and really ideas of gender shapes the imagination of what is possible to do as a person. Because for some people, their gender identity is very important and very central to the way that they think about themselves. So once I saw in couples therapy class that there was a video where the therapist suggested that it was a shared work to sort of regulate the violence that the guy was doing in the family. And I was just very much hit by the fact that we were maybe 36 academic people in that room watching that video. And no one was questioning whether it should be the woman's job to regulate that man. And it was not something that we thought about in any critical way. So that was one of the first times I really noticed that there is some stuff here around psychology and gender that we need to look further into. So, first of all, the idea of gender, where does it come from? We all know that the idea about men are from Mars and women are from Venus is maybe very outdated. But still, Cordelia Fine, who is a very clever brain researcher and psychologist, she argues that there is so much pseudoscience out there that is uncritically getting picked up and in everyday life is spoken about. When I did my bachelor thesis, I examined a newspaper article that argued that finally the conclusion was clear. We have now the final proof of there is male and female brains. And it was something that was widely shared on social media. And then me and my partner, we looked into it further in our project. And then we actually saw that this was complete bullshit science, to say it out loud. It was just a questionnaire that was handed out to college students with extremely stereotypical questions about, would you be honest if your partner asked if your partner's butt looked bad in these jeans? Like type you would see in an old episode of Friends, so to say. But this is widely quoted. And this creates the phenomenon that Cordelia Fine talks about. It is neurosexism. It is the idea that our brains are so gendered that we are maybe completely different people and we will never get to understand each other. I assume that you can all see how this is problematic. But what it also excludes is transgender people and queer people because we are left entirely out of their conversations. And while we are speaking in very stereotypical manners about majority people, that is not even helpful to majority people, we are excluding different ways of lives and identities completely. And what other position is there available than to be a complete alien, or to even be mentally ill? So, Cordelia Fine just recommended the recommendation. Her first book is about delusions of gender, and this second book she has here, Testosterone Rex, dives further into the myth of hormones shaping emotions. And that is also a negative stereotype that is often used against transgender people, that they, when they might be getting some gender-affirming care, hormone therapy, that they might change personalities, that they might get some ways of different where they cannot control their sexuality anymore. And this is even myths that some transgender people believe about themselves because they're not exposed to knowledge, but they're exposed to these certain myths that is on the internet and even in popular culture as well. So these books are quite good at debunking all this science stuff. So prioritizing a bit. Yeah. So just a short mention. If you are still considering if there is invisible patriarchal structures that is shaping heterosexual relationships and is creating a lot of dissatisfaction, I recommend this book on power relations in heterosexual couples. So, moving on to the queer perspective. Magnus Hirschfeld was one of the first people, at least in Europe, that I'm aware of. I don't, maybe you know something else, I don't. But way before the Second World War, he had the Institute of Sexuality in Berlin, where he also created a lot of knowledge, but also the first gender affirming care for transgender people. And this was like in the 20s, before the 1920s actually. And there was a whole community there that was destroyed by the Nazis, where he even had couples therapy and like communal center parties where you could go and find people like-minded as yourself. And I find it so interesting that when I go out and speak around Denmark with pedagogues and in psychiatry and stuff with people that meet these young queers, they're like, where do all these queer people come from? Like, are they just popping out from the streets, or did they get exposed to certain ideas on TikTok? And I myself find it very hard that we have a certain language around identity politics, because I feel like this term is almost expressing in some way that this is a political wind that is just blowing and shaping our ways of thinking at this moment, and identities might change. And I completely agree to that. Identities might change, but what really is changing is the knowledge and the language around identities. Because at all cultures, at all times, we actually have had gender non-conforming people. And there's been different technologies for affirming genders at certain times. People were very creative back in the day to use herbals or use different clothing or stuff like that. So this need has always been there, but it has been oppressed a lot. And not only by religious people, but a lot by science as well. Because when we leave people out of the conversation and the equation, we do not have the possibility to even describe the realities. A while ago, I saw a picture that really stuck with me, you know, this type of black and white picture where someone's character and personality really shines through. And it was a transgender person in the 50s that wore sort of a dress, but was in a mental institution. And just imagine this type of pain this person has gone through and was considered to be an immoral person, a dangerous person. And that kind of punishment was for that person at that time. But still today, we punish people that are in different bodies than cisgender bodies. It is interesting that if you try to pass and just access normal plastic surgery, and you call it something else, you have free agency to do whatever you want with your body. But at the moment, my sister is transgender and she wants to get gender affirming care, so she is satisfied with her body. It is an entire process that can be lengthy and be several years of her life. So I don't know if you work with clients that has this type of problems. Some of you not, and some of you don't. But I would compare it to that you have to be the right kind of person that your psychologist, your health worker actually understands. So if you are from a different culture, if you are autistic, if you have anything else in your journal that could be an indication of that you have gone through anything else in your life, that could be held against you. And then you have to go through lengthy processes of getting doctors' conclusions that you are not mentally ill anymore. And transgender people know this, or at least they will find out when they try to reach out in the system. They do not know that healthcare is this difficult. Some might have been researching a bit on the internet, and that creates a lot of anxiety, and they also only get the bad stories about it. So my job is very weird at times because to some degree, I need to acknowledge that the problems is there and identify that this specific client might go through something like this. And on the other hand, I'm trying to create hope for that person so they don't disregard and go to the black market instead. I don't know if you have found yourself in some of these similar dilemmas, but I find it especially hard when it is teenage transgender people that is not even 18 yet, and their parents are desperate too to get this care. So I am in a position often where I cannot talk to the needs that they might actually need because it is illegal. Yeah. Comparing to
What is illegal?
to get hormone therapy when you're a minor.
Oh, yeah, okay.
And other forms of gender affirming care. But in comparison, I saw a study about the gender affirming care that takes place in the US, and the most gender affirming care that is done is that 96% of gender affirming care on minors are cisgender young men who has too much estrogen in their bodies, so they develop extra breast tissue. And everybody can get behind that, of course, that is something that blocks this young boy's quality of life. And they would get bullied and they would get called all kinds of stuff. So I just find it interesting that when we affirm a cisgender body to fit in the category, that is something we all can get behind and understand why it would be painful to live in that body. So I'm not saying that we should do certain things to minors, but I just find it interesting that we have a sort of more panic around that question, that even leaves out of the question that we can tend to just use hormone blockers. Do you know what hormone blockers is? Okay, so that is the opportunity that we once used in Denmark, and we are not using that a lot anymore. But usually we did go to what is called sexolog's clinic, and the option there was just to use hormone blockers to postpone puberty for transgender youth. So they would not have to go through the painful development of getting facial hair and etc. So they had a prolonged time to make the decision and be more intimately known with themselves and what felt true to them. But that is getting increasingly difficult to get because we have these narratives around that there is a lot of people who regret surgeries and who regret changing sex. But that way of thinking about it is just too wrong because there is no one operation that changes your sex. There is a variety of gender affirming care and practices such as dressing differently, using binders to compress maybe a chest or to create a chest where there is none. So there's a lot of varying things we can do to affirm someone's gender and relieve gender dysphoria. So the whole concept of changing gender and regretting it is simply not the right way to think about it. Do you have any questions or yeah? Yes.
So just to understand, I mean, it's obviously it's easier to go back from binders.
Yes.
If you regret, if you want, than if you have top surgery or whatever. So what's your thoughts on that? Like with the regret part, I know you know the science behind how many regrets.
So interestingly enough, the total percentage of people regretting any surgery is about consistent as 7%.
Like also not
all like hip surgery and all kinds of surgeries.
Okay.
So and the percentage of regretting gender affirming care is less than 1%. And what is included in this less than 1% is simply people not being entirely satisfied with the visual look of it and might needing to go back for maybe changing some scars and certain patterns to where the scar is and stuff like that. So it can get a little wobbly if you get a bigger, larger chest removement, for example. So it is not that people regret it and they wish they didn't do it. It is also about aesthetics. So it is widely exaggerated that people regret.
And delaying puberty, that's not an option in Denmark, because it is in the US.
It
Puberty
is,
blockers, sorry.
it is getting less and less people, they actually stall the younger transgender people.
Okay.
Because it is not official that they have said it, but me and my colleagues working in this area, and specifically one colleague that have a lot of minor transgender people, the last 5 years or so, there's been so much public like opinions about this that they actually, our impression is at least that they are getting a bit scared.
Okay.
And they just offer long therapeutic talks that is not really clearing identity, but it's just like, oh, so you're still feeling bad, okay. And I have 16, 17-year-old transgender people coming in to me and saying, I've been in the system for so many years now, and I've been offered nothing. And my mental health is declining because I now see the effects of my puberty on my body. And everybody speaks about that this is just gender affirming care getting handed out in almost backyard alleys, and it is not at all what is going on. It is actually quite hard in Denmark now to get gender affirming care. And in the system for people above 18 years old, the unofficial politics is that you have to be at least 21 or 22, but they take people in from the age of 18. So there is also a process there where there are very unclear ideas about that you have to be stable enough. And imagine that. Just think about your teenage clients. How often have they forgotten a session? Like, if you need to wake up early in the morning, go somewhere, and you need to really be there, it could be 8 o'clock in the morning for a 19-year-old, and they have to be confident in their bodies and go out with the right amount of makeup and etc. to convince and convey that they really are the gender that they say they are. They need to almost sort of prep for a job interview in their own gender. That is what I best can describe it as. So it takes a few hours to get there with the dresses or how you try to convey yourself and to collect yourself and go in that door. So of course, sometimes you would get late or simply forget it because you've been stressing out about it. And that is something that is noted in the journal, that you are not stable or you have difficulties meeting your appointments. I'm sorry if it's getting a bit bleak here, but I just have to describe the realities of the stress that transgender people go through. So what is underneath the problems of our approach to transgender people in Denmark is that we do not have informed consent. We have created this idea that transgender people are not smart and clever informants about themselves, and our jobs as professionals is to simply meet them where they are and ask about their needs and inform them what they can expect from this type of process. We have created a system where they have to convince us and they have to check certain boxes to fit our very medicalized idea about what a transgender person are. And to be transgender in Denmark, that is a very binary way of thinking about gender. So I want to introduce to you Susan Stryker, who is a very cool historian and activist, and she is a transgender lesbian herself. And her idea of what a transgender person is and what a transgender body are is that trans just means the opposite side of something. So when you are not completely identifying positively with your assigned gender at birth, then in her terminology, you are actually transgender. And I don't know if I can get behind that idea totally, because I am non-binary and I have considered to get different types of gender affirming care. But I do not fit into that entirely, and I see the struggles that the transgender people they are having, and my storyline is very different from that. But you might get clients that uses the terminology of being transgender without ever wanting to get any type of medical care. So that's a bit confusing. So who's really transgender and who's exploring their own identity? That can be a bit blurry at times because people are complex. So do you have any questions about what a non-binary person is?
It's more like a boring statistical question.
Yes.
Is there a typical age at which one experiences as oneself as non-binary or non-cisgender in Denmark?
I can say that the gap between knowing yourself and coming out is actually closing because we have a lot more available language around it. So typically for all queers, the LGBT plus organization in Denmark said that usually around 17 or 18 years old, people would come out as queer. But now people are coming out being 11, 12. But there is a lot of science behind that many transgender people have the first experiences of being different as young as 4 years old. Yeah. And there's also been studies on that the depth to how they view themselves in relation to other where gender plays in, it is as complex and thought of as a cisgender person of that age as well. It is not just like a slight thought that is creeping out on that. It's like everyday perception that I am different, and now I'm trying to hide a certain interest from my family because I have already at this age noticed that it is laughed upon if I enjoy gender bending activities. So, yeah, quite young people know actually. And I can maybe share a little story that I also were thinking about gender when I was younger, that it has something to do with our brains and bodies. And being non-binary, and my sister is a transgender woman, we both had this weird fantasy because we saw something like a Grey's Anatomy and like all this stuff about people, they got like gender affirming care or sex changes when they were kids because they were born intersex. So we both thought that, oh, at a certain day, our parents would come and say to us, you have some body differences, and we made the choice of gender for you. So your life would be easier. And this is something my kid brain made up when I was like 11 or something like that. And I was like, oh, that explains a lot of stuff and why I don't feel like I fit in the female communities around me and are just different. And then I found out, okay, I am also like bisexual, so maybe that explains it. But there was just more to the story. But I'm just taking this up, thinking about biology as so important to determine our gender that queer people make these weird stories about themselves because we do not have language or concepts that actually affirms our lives. This is knowledge that the Nazis have burned down. So it's not so weird that silence actually kills. When you do not have the knowledge or the language to describe your lives, you just hide yourself and you try to be normal. As shocking percentage of my queer clients and also my transgender clients, they self-report that they have tried to force themselves to be heterosexual and to be cisgender as well. So they have forced themselves to watch pornography that they didn't enjoy. They have forced themselves to exaggerate certain behaviors or trying to fit in, or some just knew that it was a lost game. So when transgender people come out and when they enter the room of therapy, they have doubted themselves a lot. So I want to talk a little bit critically about what we consider to be conversion therapy and what we might need to know about what conversion therapy is more today. Because that transgender people and most queer people, they have been doubting themselves. They have had the societal messages that their bodies and lives and thoughts and feelings are completely wrong. When we challenge them in therapy and we challenge them in certain ways where we create anxiety and we take up stories about how it would be hard on their families, how it would be harder to achieve a love life and a family life, we are actually using some of the techniques that we know from the classical conversion therapy. And we might not see it as problematic because we have a heterocentrist way of thinking, that we might think that being heterosexual, being cisgender is a normal thing to be. And it's always something that if you can choose to be it, then it would be greater for you. And this is an underlying assumption that we might not know that we have. Hell, I even had it for my sister and for myself, that we wish to be normal, but we really weren't. So when you are in a position of authority and you speak to these people about their lives, we need to be really sensitive around if our client is driving the conversation or we go in front of them and suggest certain scenarios. So the next book, and it might need a bit of an update because at this time there were not so much focus on transgender people. But this book suggests that a bit different approach to many queer clients could be great. That many of our backgrounds and training has never been created in a space where we just assumed that queer life was something normal and they even lived. So we need to kind of have a bit of an update, and I like to talk about it as there's an extra train wagon that we build onto the things that we do in everyday lives now. And then by practice, it changes and it becomes sort of a more fundamental framework where we easily can see how we might bend certain ideas. To be very precise, when I was in the communal system, we worked with narrative therapy and empowering through position theory. And the idea of how fast someone could get empowered and move on and go out in everyday life and get into positive peer communities were really not working with transgender people and transgender youth, because they had a different sort of timeline, and we like to call it queer time. For example, for some of those people, they would need to get gender affirming care before entering university or further education. The thought of just stepping into these communities or spaces where they were supposed to find friendships and all sort of things, it would be unbearable for them to change the way they live their lives, their pronouns, their names, while having the same friend group. We also see a lot of transgender people just deleting social media and starting over, because it is actually sometimes very shameful that somebody knew the earlier version of you. So the communal the theology of just putting young people out and saying, oh, now you go, you've been here for a while, it was actually not fitting, and they needed to be consistent in this safer space we created for them, because they were quite a long way to getting the things that really meant something to the transgender youth. So what is something that I suggest that we can do? It is that when we meet a client that seemed maybe at times to be challenging us and be a bit ungrateful about what we do, I really recommend that we try to listen between the lines. And there are at times very non-academic ways of expressing themselves, just like, I hate this, this group is stupid or something like that. When I've met that with queer youth people, I actually found that they were quite clever, because they were right. There were some guidelines that were completely bullshit and was not meant to mean anything to some of them. It was just some politics in the communal system that really had in mind what was good for them, and they knew nothing about queer lives. So when we get this type of feedback, it is actually a gift to re-evaluate and try to use your privileges and your education to push up and say, hey, we need to change some of the stuff that we do, because there is no space for transgender youth out there. We are actually the only group. So maybe we need to change that they can be here until they're a bit older, even if there's not money enough for it. Let's find the money, let's go and seek out some funding and try to change it a bit up. And something else that the book Pink Therapy is also suggesting is that using different media in therapy can both ways work as a very great informant. So I like to ask my transgender clients, like, what movies do you watch? What books do you mirror yourself onto? Is there maybe even a YouTube channel where you have a role model there? So I really try to get inside the heads of these young people and see what is meaningful to them. And that is often something very different from what I was taught at university. Because sometimes these queer lives, they are maybe not widely researched upon or represented in different statistics, but they are there in the art and the literature. So I just recommend a lot to go to these sources and reevaluate what sources of knowledge you might want to use in your practices. And I also consider to like the life stories of queer people themselves to be the greatest informant of what is currently going on, because I can't keep up. And like and I'm also getting challenged by new language around gender all the time, which I find positive, but I'm just trying to like keep my head on and just go with the flow and not be too critical, because I also want to be comfortable and be like, oh, now I know, and now we're working with this model, but then something new comes up. Yeah. So I've been talking in many different directions, but really, do you have any questions or maybe something to sit with a bit, maybe some myths around gender or transgender life? You're very welcome to ask at any level. There's no bad questions here. Yeah.
I think from my cisgender heterosexual perspective, it's notable how there's a lot more representation of the queer or non-binary in series and books and all of that. And I'm just wondering, how is that experienced from your perspective, from the non-binary insider perspective?
For me, I actually enjoy it a lot, but I always also wonder that some of the representations that are out there is not as intersectional as I want, because it is often more privileged people or people that has a certain degree of correct language of describing themselves. And the queers I met in the communal systems, they do not have the knowledge or the correct language of describing themselves. So I might meet a young person and I'm just using their language, and they are saying that I am a transsexual hooker. And they are living in between genders, like you might see a feminine boy with a lot of bling, but they are using transsexual as a old, demeaning language, but this is the language they're getting exposed to. And I think that more privileged queers in different bigger cities around, they carry with pride that we do have this language and understanding of gender that is getting very elitist for a lot of queer life out there. And I also think that some people even look down on not having the correct politically correct language around themselves. So I just wish that more representation and love also were around people not having the right language, because it's presented so polished and positively and coming out and there's a story and happily ever after. And also a lot of stories is centered around the coming out. And for a lot of people, and this is also tied to maybe your next brown bag reading, I know that in SABA, the organization for ethnic minorities that is queer, that the consequences for coming out from some of them has actually made them regret coming out. And our media really focuses on that you get empowered when you do come out. So I find it very positive. There is a lot of my clients that it is so meaningful to them, and even something that they need to consume in order to like cope with severe depression and self-harm. Just to look at this series of role models, but at the same time, we need more nuance. Yeah,
Thank you.
no problem. Yeah.
I wanted to ask, because I know that Denmark was kind of unilaterally decided to not use gender dysphoria as a diagnosis at some point.
Yes.
And now he's saying that it seems that it didn't really make the path of a trans person within the system easier, or maybe it was a response to that. That they opened the gates and they got scared. And so I wonder how you think, or maybe it was a political stunt or something. So I wonder how you think about that. Like, was it in any way helpful or not, or did it change much?
So a lot of different things changed at that time. So of course it is very positive not to be viewed as mentally ill when you are a transgender person. And the idea of that you can only be transgender if you have severe gender dysphoria is of course closing the conversation down around nuances. Remember what Susan Striker is talking about, that there's a lot of differences in regards of gender and non-binary identities. But the problem is that at the same time that they did this, they centralized gender affirming care. So before you could actually get hormone therapy going to your regular doctor. But now they made the change that it was illegal for the doctors to do that. And a lot of people were actually getting kicked out from their gender affirming care and had to start all over and go to, at first, Rigshospitalet, CKI, Center for Critical Identity, and start over with a lot of their processes. So now there is this sort of centralized way of getting gender affirming care. So their politics means a lot in people's lives, and that is what is harder. So some of my bit elder transgender clients, they actually say that they prefer the old system because it was easier for them to get things done because they could prove that they had severe gender dysphoria. But now it's a bit more wishy-washy, it's a bit more of an individualistic evaluation approach where the psychologists and the other people in their own biases is really let loose because it is not so clear anymore. Because you just had that diagnosis before, and now you have all these certain questionnaires and like.
So then, up to the individual psychologist.
Yeah. And you can see how much power plays into that. Yeah. And how honest you can and cannot be in that space anymore about yourself. And then we're back to having the job interview about your gender, like presenting a good gender that everybody gets. So I might ask you, did you play with dolls in your childhood? Of course you did. And you love to wear dresses? Of course you do. So the problem is that at least in some of these spaces, the psychologists are not getting challenged about gender either. Like they are also presented to somewhat stereotypical ideas of transgender people. It is not as bad in Jutland and Odense and other spaces, but in Copenhagen, it is the most traditional place of them all. So if you ask to recommend anyone to get gender affirming care and go to the doctors, ask about not being at Rigshospitalet. That is very important. I did not expect to get this practical. I prepared a lot of other stuff for you, but it just seems like this is very important. So another point to make, just going a bit back to this book, is when you try to affirm your client in living their best life, still be cautious about gendering stuff they are doing. So I have done some mistakes where I was like, oh, nice nails, it really draws out your femininity. And the person was just like, nail polish, and this is nothing relation to gender for me. And like, and I was just trying to say the right thing, but just
It's
affirm.
nice to know that you make mistakes.
Yeah, but all the time I'm trying to be so neutral that sometimes my client sees me and they're like, but you know this. I'm like, yeah, but last week someone was feeling quite upset about a certain language or certain idea. Another thing that I don't know if you're in this deep with your queer clients, but a way to talk about gender instead of male and female is very, very popular to use AMAP or AFAB. So assigned male at birth or assigned female at birth. And it is usually used in terms of talking about gender socialization. So what different behaviors one might do because we were taught to do that. But some of the transgender people that I have in therapy really hate this idea because they're saying, I was never socialized a male or female. I was in the closet and my identity and storyline is very, very different from being socialized as a cisgender boy or girl. So be cautious and just look for what your client is using in terms of thinking themselves. And if I have a long day, I really try to tone it down and just look for cues if I don't remember this depth of conversation. But I might add like small things like does not like the word transgender woman, likes to talk to about herself just as a woman with a different backstory. Like all these small things is something that really strengthens our relationship in therapy. Yeah. I'm noticing that we have 5 minutes left. And any question?
I took a question or
Yeah.
just a consideration because what you've been saying your experience with clients, it seems to me, from what I get, that they come to you because they need to learn how to deal, they want to learn how to deal with getting space
Yes.
for their gender. And I was thinking, well, my experience is exactly the other way around. Because every time I've had clients that are not binary or they are homosexuals, they come to me because they want to be saved. Meaning like, well, teach me, how is that I am not homosexual or I am not binary.
Mm-hmm.
And I'm just wondering, how come? I wonder if the psychologist thinks, well, that they choose me because I am heterosexual, I have on my homepage that
Yes.
I sound very heterosexual, I'm aware of this, so they might think, okay, I come to you because, and how to deal with that, because I don't want to teach you to, count me out, I cannot help you because you're not going to be happy. So that's not the way, but on the other hand, I also feel like sometimes, I don't know, cheating them by, they come in session and they have the validation and they have, the acceptance and the encouragement, and then they come out. And as you are describing, the society is not always ready to say, yes, come to me for one. Oh, I don't know, I'm not sure I have a question, it was more like a series of considerations.
Yes. This is brilliant points, and it is also something that others have pointed out to me. And it also creates a little bit of a barrier in the conversation because some heterosexual therapists might experience that, oh, there is a lot of people who struggle by this and who is regretting. And I'm getting all the ones that when they look at me, obviously there is some idea of someone being okay with having a weird haircut and that's the way to go, something like that. So of course there is a bias in our clients choosing us. Yeah, and this is about internalized transphobia. And there's a lot about internalized queerphobia in this book as well that I would recommend. So, and it comes out in different ways. It comes out in choices about what you expect a therapist to be and what the project is. Yeah, and I have even had some parents also ask me about if I can just help their kids to be happy with who they are. In the understanding that being happy with the body that they do have.
Okay, that way, I thought
Yeah.
you meant like in
Yeah.
a real way. Probably.
Yeah, but the parents are concerned because they know it's a difficult past, and I don't exactly consider it to be transphobic per se, but they just wish the best for their child, and they have nothing else to stand on or grasp in than myths and popular media. So I always say, like, I cannot help anybody be something that they are really not, but we can unpack together what that means. And we can unpack together and be together in the grief and the anger about how society positions us, that we always have to like come up with deep and well argumented stories about ourselves just to exist. Yeah. So one last thing, I was trying to go to therapy myself, and the guy was like, "Oh, I am totally gender affirming and all this," and he was referencing a lot of evolutionary psychology and brain research, and he was like, "Yeah, I saw this study where they put transgender people inside a brain scanner, and we saw that they were very similar to cisgender people of the opposite sex, so that confirms that transgender people exist." And I was just, wait. It is not as, I think that this science is more for you than it is for me. Because queer people know that they exist. So, yeah. But it's just such a challenge to always be arguing about your own existence. And I don't have the time to talk about minority stress, but this is the level that we always have to be explaining ourselves, even in our mannerisms. When I was at my last psychology clinic, people were cursing me, "Oh, you're non-binary, but you're wearing lipstick today." What does that mean? Like, every day I had to like consider what different clothing choices and etc. would mean to how my colleagues were relating to me. And it was so damn stressful. And I was doing lectures about minority stress and such. And I was just like deep inside it myself at all times. So it was actually a relief to get out and create a home clinic for a while and just focusing on my social work. And now I'm going back out there again on a clinic in a few weeks. And I have learned just to be more unapologetic. But of course it is affecting us. And I think that minority stress is something that you can never really defeat. So we just need to know where this distress and discomfort comes from. Yeah. Okay, respecting your time. I am here if you have anything to ask about, or you can just get my email if you want some specific books or something. But I can just send you a list, and no problem. Thank you for your time.
The books might be helpful, actually, maybe you can send it to them.
Yes, and I can categorize it a bit.